Good afternoon and welcome everyone. We'd like to thank you for joining today's webinar. I'm Melissa Kraus, the Corporate Relations Assistant for the National Association of Counties. We're really excited to have Stage Analytics here, spotlighting Stage Care's Community Abatement Resources Economic Solutions. CARES is designed to help counties and states effectively solve their opioid epidemic through innovative evidence-based tools and strategies. Just a couple quick notes before we get started. We do like to encourage everyone to add your county or where you are from, and you can do so by clicking on the three dots, click rename, and then add your county or where you're from right after your name. They're always helpful to know that information for discussions. And then we also ask that you keep yourself muted throughout the presentation. There will be time at the end of the webinar for questions and answers, and we do ask that if you have any questions throughout the presentations to submit those in the Q&A section rather than the chat. And now I'd like to introduce Leanne Slaughterbeck. She is the Director of Product Enablement for Stage Analytics, who will share more about today's webinar and introduce our presenters.
Thank you, Melissa. And thank you everyone for joining us on the call today. We appreciate you taking the time out of your busy day to join us. And we also appreciate the effort that you are undertaking to abate the opioid epidemic in your community. Again, my name is Leanne Slaughterbeck. I am the Director of Product Enablement at Stage Analytics, and I will be your guide through today's presentation. We have a lot to cover, and we're excited to get started. So let me introduce our first speaker. Dr. Bill Padula is a co-founder and principal at Stage Analytics, as well as a professor of pharmaceutical and health economics at the University of Southern California, Mann School of Pharmacy. Dr. Padula is a thought leader in health economics and outcomes research, and he's served as a health economics expert witness in county and state opioid litigation cases. Over to you, Bill.
Thanks, Leanne. My name is Bill. My mom calls me Dr. Padula, but you guys can call me Bill on the line here. I'm really excited to be here today. I got to attend NACO for the first time this past year and learn a lot about your organization and the conference. It was a wonderful time meeting people at counties, parishes, reservations, nations around the United States. And there was one thing that struck me in many of the conversations that I had with those of you in attendance in Tampa, which was that we're all affected by the opioid epidemic. It doesn't need much of an introduction. Obviously, this started 2 decades ago with the flooding of the market with prescription opioids like OxyContin, got people hooked, and they switched over to illicit drugs like heroin and fentanyl. It's destroyed lives, it's destroyed families, and it's destroyed communities, and it's costing billions of dollars to clean up the mess left behind by these prescription opioids. And our organization, Stage Analytics, has been at the heart of the matter for the better part of a decade now. To highlight some of the timeline where our company has been involved, my partner, Caleb Alexander, who you'll hear from shortly, has been involved in opioid abatement going back to 2017, testifying in the bellwether cases and the MDL across the country in front of many judges, grand juries, juries, members of Congress, explaining what the state of the situation is and what it takes to fix it or abate it, as we would put it. So we've come a long way in being prescriptive about a community opioid abatement assessment and strategy. And that led to involvement in many more cases that have happened recently at counties individually, trying to settle suits for abatement and damages of the opioid epidemic. And as a result of all of this, what's been an interesting experience for Caleb and I and our company is that we've been asked to now help and support the implementation of an abatement plan that we developed and costed out and prescribed during these cases. And so we have now this patent pending technology that Leanne described, Stage Cares is what we call it, as a complete economic and structural model to implement to guide you through an evidence-based abatement process for the opioid epidemic. We go to the next slide. You'll see that this has actually been very carefully reviewed our work in these cases. We've gotten a lot of coverage for our testimony, for what we've developed as the way to fix the opioid epidemic. And media from San Francisco to Baltimore to even The Guardian in the UK have talked about the model that Caleb Alexander and colleagues and I have created for abating the opioid epidemic is the one that works. And it's the one that judges and juries and congressmen have all agreed needs to be implemented, not just in these counties that won their cases, but nationwide. And so we're trying to create an opportunity where Stage Cares is the model built off of these decisions made in court cases that everyone can have access to. It's a replicable model of opioid abatement. And we'll get into a couple details in the next few slides about what it'll take to actually implement this locally. If you go to the next slide. So our national expertise informs this CARES platform. And what is CARES? CARES is a data-driven platform that uses AI and machine learning to be prescriptive locally on how to abate the opioid epidemic based on the unique characteristics of your community. And so it doesn't matter whether you're a county with 400 people or 400,000 people. Our CARES model uses unique data sets from national databases like NESTA and NHANES, these big federal databases funded by HHS and the like, to prescribe how do we overcome this epidemic. And so we have over a unique set of over 1 billion data points that are informing CARES, and it's continually being updated with these data in order to deliver actionable insights at local, regional, and state levels. So the opportunity exists here to introduce a solution locally that you can use to figure out, how am I going to allocate resources? How much money is it going to cost? And what's the best way to optimize the allocation of resources in order to abate the epidemic as efficiently as possible? And obviously, this isn't going to happen quickly. This is a years-long process or decades-long process, but it starts with finding the right tool set to inform your local coordinators in the opioid epidemic in order to actionize a proper abatement plan. It takes me to the next slide. You know, something that I've thought a lot about as a professor in health economics at USC and Johns Hopkins is that none of my students were ever taught while they were getting an MPH or a PhD, how do you fix the opioid epidemic? How do you account for the economic and epidemiologic factors that go into creating a solution? And I appreciate that at the government level, where many of you and your colleagues are starting off on this solution-based issue to the opioid epidemic from scratch. The good news is that Stage Analytics and the CARES platform are really here to help, to partner, that we have models based on these big data that can project county level outcomes based on what you're doing already and how using CARES could potentially improve your outcomes by investing in the right places. Obviously, you might already be thinking, I got to support my police department, my fire department, my health department, my homeless shelters. But there are other solutions that we've identified that are evidence-based in the abatement plan that engage other parts of your community that maybe you're not thinking about. And $1 spent there instead of an extra $1 spent on the police department may be good value for money. The best way to find out is to partner with us and understand where you achieve the best value for money across an abatement plan. And the good news is that over time with CARES, you'd be able to track these outcomes, and that actually the model with the integrated AI platform is able to update and adjust where your resource allocation should be in the future based on what you're achieving and outcomes. So I believe Stage and CARES in particular is a great partnership for many counties and government organizations, because you're able to constantly be reevaluating your progress and setting new milestones and new goals of where you allocate your resources. So bottom line here is that it's a good tool. It's based on evidence in JAMA and a publication in JAMA. and it'll help you build capacity to recover from the serious opioid epidemic. I want to, from here, turn it over to Leanne again, who will introduce the next speaker.
Thank you, Bill. Our next presenter is Dr. Caleb Alexander. Dr. Alexander is a co-founder and a principal at Stage Analytics. He's also a professor of epidemiology and medicine at Johns Hopkins Bloomberg School of Public Health and a practicing board-certified primary care physician. Dr. Alexander is recognized as the global expert on the opioid epidemic and served as the primary plaintiff's abatement expert in the federal multi-district opioid litigation cases. Over to you, Dr. Alexander.
Thank you. Thank you all for your interest in this matter today. And you know, as Bill was speaking, I was reminded of a quote from Greta Johnson from Summit County, Ohio, in the Wall Street Journal. And this was actually a quote that I used when I had the opportunity and privilege to meet with the Congressional Doctors Caucus, which is a group of Congress people who are have a background in healthcare and who are committed to healthcare matters. And we were able to meet and discuss more about opioid abatement. And what Greta said is in this quote is, the other hard part is that there are still people dying. We're still going to lose people, and we have all this money, but still can't save everyone. And it was a reminder to me both about how grave the matter remains, and also the fact that there's a real scarcity. It's not like, you know, you have a pot of money and you have work to do, and we just need to figure out where to put the money to get the work done. No, the pot of money is not nearly big enough for the amount of work that needs to be done. Summit County is an example, frankly, which is where we had the opportunity through, and this is, you know, all publicly disclosed, but we had the opportunity to participate in working through the design of an abatement program for that county, and then subsequently to work with Summit some on some of their activities after the fact. So, you know, and I also just in beginning want to thank NACO, frankly, for NACO for your leadership and your working to stay out front and to help support counties that are working through tough problems right now regarding the challenge of ongoing morbidity and mortality from opioids, and important questions about where resources should best be allocated. As Leanne mentioned, and as you heard from Bill, the CARES platform is built upon this important foundation, namely the evidence and models and programs and services that were developed for cities and counties around the country and customized for them as part of the national multi-district or MDL litigation. And our work with cities and counties like yours has provided us with many valuable lessons, not the least of which is that that local leaders on the ground have enormous experience to bring to bear, and that while the evidence doesn't change, whether you're in Maine or Mississippi, the epidemic has manifest uniquely in different settings. In addition, every city and county, we recognized every city and county is doing something, and most are doing many, many things. And CARES is built with this in mind. So it has many different functionalities. It allows for you to assess or perhaps reassess local strengths and local needs. It allows for you to develop evidence-based and evidence-informed plans. It allows for you to build budgets, and it allows for you to iteratively evaluate and report outcomes. As many of you know, it's not like all the money has been delivered in a chest or in a bank and it's there to spend. The money will flow and continue to flow in cycles over 18 to as much as 25 or 26 years or more. And so there's sort of a good news and bad news side of this. I suppose the bad news is that there's so much need right now, and so many people continuing to die. The good news is that cities and counties don't have to figure this all out in one fell swoop. And frankly, the epidemic is going to continue to change and evolve over time. And the fact that resources will flow over time has allowed for us to build cares to support planning cycles and cycles of implementation and cycles of evaluation, so that cities and counties can learn from their track record, learn from their experiences, learn from each other. There's a very important benchmarking function in CARES as well that allows for cities and counties to understand more about what other cities and counties like them are facing, and then to continue to build programs accordingly and evaluate them. Next slide. So again, CARES is designed to help maximize impact, or what my economist friends will call return on investment of your abatement funds. And we're fortunate, we're not the only organization or group that's working to support cities and counties, and there are others that are working to make a difference as well. Some are developing principles that should govern an effective principles governing abatement spending. Some are developing maps of how much a particular state has received in abatement funds. Some are developing potential measures libraries, libraries of measures, so that if you want to know how to measure impact, you can go and look at this library and see what type of measure might be useful. Some are measuring or developing treatment guidelines to inform, to help jurisdictions expand treatment for opioid use disorder. These are all important, but they're narrow. They're narrow slices of the waterfront. They're narrow slices of what a jurisdiction such as yours needs to do to effectively abate the epidemic. By contrast, CARES is a comprehensive soup to nuts platform that offers a critical solution suite that you'll hear more about, and I believe have an opportunity to see demonstrated as well in just a few minutes. So CARES can help you estimate not only conduct a needs assessment and to align with other key decision makers within the county on where resources should be allocated, but also to understand and estimate the magnitude of resources. How many dollars are you going to need to spend after incorporating your strengths, your current investments, your data, information that you may have available, and short, medium, and long-term priorities. CARES empowers decision makers to build budgets that maximize available resources. So I'll give just two brief examples. One, using our analytic platform, we can help to develop estimates of how much naloxone is likely to be needed in your jurisdiction, and importantly, how this is likely to change over time as the epidemic continues to unfold and as you make investments in your community. Your knowledge, we're not going to tell you how much you need, but we can estimate what we believe may be estimates of how much you need, and your knowledge and existing mastery of where there may be hotspots and so on, and how naloxone has been allocated to date, can help to refine these estimates and guide decision making regarding how the product should be distributed across sites of care and, for example, community boxes. So the platform can be used to estimate needs, model how they're likely to change over time, and understand the local costs. A second example, say that you've decided that treating pregnant women with opioid use disorder is a top priority, and you're fortunate that you have $250,000 to invest in such a program. CARES can be used not only to inform that decision to invest those funds, for example, by estimating the number of pregnant women that are likely to have opioid use disorder in your jurisdiction, but also to help you to establish benchmarks and to provide a framework for evaluation that can be used to maximize the accountability and the impact of that investment, as well as to understand whether or not or to what degree the investment has achieved its agreed upon aims. Next slide. CARES is not just a technology. I mean, I'm just as excited as the next person about the technology that it's a technology-enabled platform, but it's a lot more than that. And it includes a dynamic and well-trained customer success team. In other words, your success is our success. And the platform has been designed to foster partnership through many vehicles, including live customer support, extensive training, access to nationally renowned opioid abatement experts, compliant reporting, and annual data and software updates. Next slide. So I think this is my last slide, and it's just to remind all of you that the CARES platform and tools are closely aligned with the abatement principles that NACO has helpfully endorsed and distributed. So it's a tool that does the work with you, rather than just being a reference. And again, the sort of functionalities that it includes and that I think you see here are ones that we haven't visited a city or county yet and worked with a city or county yet where these sorts of functionalities weren't important in helping them to maximize the value and return on investment of their abatement efforts. So we recognize that you are the leaders, you are the experts, you are the key decision makers within your own communities, and we and the CARES platform are here to support you. So thank you again for your interest. Thank you to NACO for your leadership in this important matter. And Leanne, I'll hand it back to you.
Thank you, Dr. Alexander. Our next presenter is Rick Rose. He's a community leader in Wisconsin, in addition to being a supervisor in Dane County. Rick is here to share with us his experience in public health issues and his passion for opioid abatement. Over to you, Rick.
Thanks, Leanne. It was exciting to hear this represented. I was one of those fortunate people to meet you guys down in Tampa when you guys presented. So it's super exciting to be here today to share with another group of people. You can see on the screen some of my background. I was elected to my first of 2 terms in 2022, but just to back it up a little bit, whenever we have these discussions, it's hard. We wouldn't be here today if there wasn't a life, yet alone many lives lost. And we're just here trying to figure it out. So for me, my life has always been dedicated to working with someone, one person at a time, whether that was a single mom that had challenges, or I'm a court-appointed special advocate helping kids in the foster system. I lived through HIV/AIDS. I was part of that whole movement. We all have survived COVID. I was actively involved in that. And one day I woke up and realized I am making a difference in people's lives, one person at a time. But I need to do something greater because there are so many barriers that I faced in doing my advocacy work that needed to be broken down. And to be an elected official was one of the greatest gifts I got in my life. And it's interesting because when we're talking about opioid abatement, you would think that we've got it figured out in Dane County. We're one of the largest counties in the state. We are one of the most progressive counties in the country, but still people are dying. We haven't figured this out. And part of it is a bureaucracy. There's 37 of me. We have 37 commissioners. Whenever I speak to other electeds at a conference like NACO, they're like, wow, how do you get anything done? So it is very, very challenging. It is what we've heard Bill speak to and Caleb speak to. You know, communication is key. When you have so many different departments, look at the committees I sit on, public protection and justice, personal and finance. You know, we're only part-time people, and to try to even communicate what's going on is a challenge. So let me say what happened to me. My first NACO experience, I learned about the great work that Sammy and her team are doing with the Opioid Solution Center. That was really exciting, motivated me. It got me to go back, look at our budget, pull $800,000 that was being allotted in our budget by the executive to do an anti-fentanyl campaign. And that didn't speak right to me. I just lost a friend to this pandemic. And I was like, $800,000 telling people that fentanyl is dangerous is a lot of money when we're hearing it every day, you know, in the news. So we formed a subcommittee. It's what we did in Dane County to directly deal with opioid settlement funds. And we were able to move that $800,000 and use it to do things like investigate and do a study on what it would cost to put forward an overdose prevention center. We also are creating the first harm reduction drop-in center. So we're doing some great work, but let me bring it to why I'm here today. So at this conference, I had read that Stage Analytics was presenting on CARES. Unfortunately, I think many of you know, when you're at this conference, you got 100 things going on, and I missed the session. And I apologized, later. All my friends were texting me like, Rose, you need to be at this one. Supervisor, you need to go. So I walked down and met Caleb and met Bill and met Jamie, who I know is on the call, and Leanne. And what you're hearing today is the experience I got. It was so personalized. I appreciate so much what Bill and Caleb said. This is about people. And I was able to go back and bring to Dade County what CARES has offered. And we put together many, many groups and looked at many of the great things that Caleb's already addressed. It was great to rehear it. And let me just speak to you now as fellow electeds or fellow people working about the things we've learned so far in Dane County regarding opioids and why I think CARES is a great solution, why we're looking at it. So on the next slide, you'll see the lessons we learned. I just want to highlight these real quick. And we know we face it. We went through a tobacco settlement that was miserable, and the money was mismanaged poorly, and we still deal with the effects of tobacco. We have not really addressed it. COVID ARPA money is running out. We placed it fast. Those dollars are running out. We all know that. This also provides us to do something differently. When you look at any of the decisions we made, data-informed decisions is everything, as we heard earlier in the presentation. Sustainability, we must make those our top priorities. Information and communication, our power. These are all things that CARES provides and this platform provides. As I said earlier, lives are still being lost. We need to all be on the same page, whether we're county entities, whether we're a greater community. And I love that CARES brings that. I've met my contacts in Georgia. I've met friends in other states and communities, thanks to my friends at CARES, to see what they're doing and how they're all best practicing this. And we have to be able, and I think that's what I love about this platform the most, to pivot in any direction. We talk about Narcan, we talk about all that, but guess what? In 3 weeks, we may not be talking about Narcan anymore. We have to be looking at the new tranks and the new effects of this crisis that are coming. You have to be nimble and be able to pivot on a dime. And lastly, talking about efficiency, building an in-house system like you just heard described, managing that system, hiring someone to do data collection and data analysis is a cost burden, very difficult to pass on any level. But Stage CARES technology does this, and it really is a cost benefit. And that's why we were able to have success in Dane County in looking at CARES as an opportunity to help us in our work. So thanks, Leanne. Thanks, Bill. Thanks, Caleb. Thank you guys for listening to me.
Thank you, Rick. We appreciate you taking the time to join us today and share your insights. All right, moving along now, we have the opportunity to dig into Stage CARES and an overview of the tools and resources that are part of the platform. So Stage CARES is an innovative all-in-one solution that provides essential tools and resources for abating the opioid epidemic at a county level. It allows counties to streamline their initiatives without the complexity of having to manage multiple vendors. So as we dig in here, we're going to go through these 10 items listed on the screen here. So let's start with our dashboards. Dashboards are presented throughout Stage CARES. On our main page, the dashboards presented allow you to get insight into the budgets that have been set for the programs and pillars. We have 3 pillars within the Stage CARES platform, prevention, treatment, and recovery. So you have the ability to look at the budgets that have been established and see the spending for each of those programs and pillars in the platform. You also on this main dashboard have the ability to review performance metrics. How are your programs performing against the goals that you have set? So you're tracking the data on all of these programs. It all rolls up at the dashboard in real time, and you can get insight into everything that's happening. You have transparency for stakeholders. The other part of CARES that we have is the ability to be able to create reports to meet settlement requirements, or be able to create reports off of any of the data that's collected within the Stage CARES platform. And a key part of the Stage Cares platform is our patent pending analytics. So as both Bill and Caleb mentioned earlier, the patent pending analytics are really, they drive opioid abatement needs for your community. They drive the estimates and projections for the opioid epidemic and demonstrate progress of your opioid abatement initiatives that you have active within your community. So you have the ability to dig in and view total opioid overdose deaths and the projection over time. And we're projected out 18 years. Well, I say that, sorry, we're projected out through, we display through 2019 or 2029. That is 18 years, I think, or since the beginning. You also have the ability then to be able to look at individuals that are currently in recovery. And you have the ability to evaluate individuals with active opioid use disorder. And what these projections give you is that trend line. And you have the ability to incorporate programs from the strategic plan that we provide to you. And you can see the progress that those plans are making on those projections. So if you are implementing a program or the strategic plan at 25%, how is that impacting those overdose deaths over time? We talked earlier about the opioid needs assessment. So we start our process of implementation with this opioid needs assessment. We have already collected all of the data needed for individual counties that goes into our analytic projections. And then we come in and we meet you where you are. If you have currently conducted a community needs assessment, we will work with you to ensure that your findings are displayed within the Stage Cares platform. And within our software, we take a qualitative and quantitative approach to collecting data from key stakeholders and community members to really get an understanding of the real world needs of your county. The assessment tool identifies community priorities, strengths, and areas for improvement. And we utilize an automated tool to collect all of that data, and it is displayed for any user within the Stage Cares platform to be able to see the findings from the assessment. That assessment, combined with our opioid expertise, drives us for our strategic opioid abatement plan for your community, your county, region, state. And it's displayed in a report format for you, and it's also visually displayed within the Stage Cares platform. So within our program library, you have the ability to see the programs that have been identified as the most impactful or most needed for your community. It's interactive. You can see those programs that are already active within a community. You can see the recommended programs that we have within the community. We have a match score, so anything with 5 stars on it means it's a program that we recommend to meet your current needs. It is customized to incorporate, again, all of the activities that you already have, the programs that are active, and be able to track those projections. Again, we group all of our programs, there are 39 in our system at the moment, into the 3 pillars of prevention, treatment, and recovery. I will also add that we are constantly evaluating new programs to add to the Stage Cares platform. All right, the programs. We utilize all evidence-based programs within Stage Cares. So within a program, you have the ability to see the description for the program. You have the ability to see the evidence-based citations that were used to build this program. You also have the ability to dig in and see the impact the program can make within your community, the total population that benefits from this program, and also see what services or resources would be needed to successfully implement this program in your community. Planning at the program level. So in addition to all of the resources that we give to support the evidence behind the program, and we provide you with resources on how you can begin implementing that program and build that program within your community. Another key area that incorporates the patent pending analytics that we mentioned earlier has to do with the recommendations and cost estimates. So Bill touched on this earlier. I think Caleb did as well. As we are digging in at a program level, we're using those analytics to provide you with the resources and the recommendations and cost estimates to fully implement this program. This shows you the projected number of individuals that can be impacted by a program. It could show you the projected number of naloxone boxes needed for your community, and it provides you with those corresponding costs. All of those recommendations and all of those costs are unique to your county, region, or state. So we're taking in all the data we're collecting, customizing it to meet your needs. This allows you to view the total cost and allocate resources that you currently have and see how much of the program can be implemented over time. So we do provide you with this calculator that lets you project over time how much resources you would need then, and at what level are you implementing this program in your community. The other area of the program library card here is we give you that standard area to be able to collect data. So you have consistent and compliant data that is collected for every program within the Stage Cares platform. You're collecting and recording budget information. You are collecting and recording transaction and activity information. Also, from a budgeting standpoint, because Stage Cares does allow you to be able to record and track settlement funds, if there are additional grants or additional donations made within your community, you can associate these activities and transactions directly to the funds that are used to conduct the transactions within the program. All right, planning, budgeting. Here's another real-time dashboard and workbook that we have within the system. So we looked at the dashboards on the main page that gives you that high-level overview of the budgets and the spend within the active programs within a community. In the budgeting and financial section of CARES, we give you the ability to drill down into individual programs and pillars and view those budgets that have been set and the progress that has been made. So is your spending for a specific project or program in alignment with what you have budgeted at the moment? So you can view them a lot of different ways. You can view them again by the pillars, by the programs. You can, from the workbook, also enter transaction data for a program. And all of the requirements here for data collection, along with the budgeting, are compliant and meet settlement needs. All right, we've talked a little bit about this data collection and metric library. So let's get into the program level here. We have the evidence-based evaluation measurement library, and you can set your program goals. Okay, so we're using that cost estimator and the recommendations that we've provided for every program, and you're determining what your goal is for that program. So how much of those recommendations can you implement? You have the ability to set those and then be able to consistently track those performance measures and their activities over time. So it gives you that central storage for all of the data that is tied to a specific program. The program evaluation. So additionally, we've set the goal. Now we are tracking the data for the performance of that goal. How close are we getting to that goal? Stage Cares provides you with key measures, but we also give you the flexibility to add your own performance metrics to be able to track it in association with an active program in the system. The performance of a program does get rolled up at that main dashboard when we look at the program pillars. and the individual programs themselves, and we can see how close we are to the goals that we have set for the program. So are we at 75% of hitting our goal at this point in the year? Are we maybe a little bit behind? Do we need to make some adjustments for our goals? We can pivot here. Rick talked about this. Dr. Alexander talked about this. We can pivot. If we've already exceeded our goals, we need to, increase them for the year. So we do have the flexibility to be able to do that as well. We include an epidemiology map. So Dr. Alexander talked about this earlier with regards to benchmarking and understanding your county's epidemic. So you have the ability to be able to view data by a specific time frame. There are unique filters within the epidemiology map too that allow you to view the overdose death and number and the rate for your community. And you have the ability to add multiple counties or states to this report that you're viewing here to see how you align with neighboring counties. Do you have more overdose deaths than a neighboring county? Do you have a little bit less? How does your state look compared to other states within the region as well? So it's an interactive map that is available for you to be able to drill in and view the patent pending analytics then that pull this data for your community. All right, we talked earlier about, our goal at Stage Cares is not simply just to provide you with an opioid abatement technology platform that's patent pending, but we also want to partner with you, and we will partner with you, to ensure the success. We're looking at long-term partnerships here, where we work with you to ensure that you are utilizing the platform to its fullest extent, that you are collecting data in the right format, that you are recording data on a consistent basis, and that you're supported in any way that you may need. We have dedicated customer success teams that include CARES coordinators. They include CARES implementation and customer success associates, and also include public health analysts. In addition to the customer success teams, part of their role is the successful implementation and onboarding of the Stage Cares platform in your community. And we also offer then real-time support. You get a live person when you utilize the chat feature within Stage Cares. If you send us an email, you're going to get an automatic response. I'm not a huge fan of bots, so we don't utilize bots within our system. And as a summary here, for today's webinar, we really covered a lot. We got to dig into the discovery portion and how Stage Cares patent pending technology delivers data-driven recommendations and cost estimates for your county. We were able to dig in and learn how Stage Cares develops evidence-based opioid abatement plans and budgets for counties, regions, and states. We were able to gain insights from a local leader on how technology fosters efficient collaboration and delivers a sustainable solution for long-term success. And we were able to look at an overview of the Stage Cares platform and the innovative tools that offer support for your opioid abatement journey. Our goal is to help you solve the opioid epidemic at your county and state levels. And as we begin the Q&A, I would again like to thank you for joining us today. I would also invite you to visit our website and connect with us on LinkedIn to stay up to date on the latest developments and resources in opioid abatement technology. If you are interested in seeing a personalized demonstration of how Stage Cares can benefit your county, region, or state, you can scan the QR code here and schedule a demo. And I would also let you know that in the upcoming weeks, we will be offering a weekly demonstration of Stage Cares in action. They will be conducted on Thursdays at 2 p.m. And if you stay tuned to our website, you will see when those weekly webinars begin, and you'll have the ability to be able to register for a future session. So as we wrap up here, let's dig into Q&A and go through some of the questions that we have received. All right. One of the questions that we have here is, what does the admin time look like for utilizing the software? So admin time for utilizing the software. Okay. Let's go ahead. I'll go ahead and grab this one. So the admin time. At the beginning, we typically assign a community admin that is responsible for identifying the key stakeholders that will be users of the platform. That means you can add up to 10 users within your county, and you can purchase additional users if your need exceeds that 10. But users can be everyone from program managers. They can be data analysts that are collecting data for your community, and anyone that's responsible for compliant reporting or monitoring those dashboards within the Stage Cares platform. So we work with that admin of the system to be able to identify the key stakeholders needed for the needs assessment. We work with them on alignment and consensus on that assessment. We work with them on the kickoff, the implementation, and scheduling training with the individuals that will be using the system. And then ongoing support. So if there's ever a need that an admin has, or a question, or if they need to maybe replace users in the platform due to attrition, they can reach out to us at any time, and we're here to support you along the way. So it's not a huge burden to be able to work with us and get the platform up and running in a timely manner. All right. I'm getting a couple of questions about the cost of Stage Cares. All right, so let's dig into the cost of Stage Cares. I would welcome the opportunity to speak with everyone individually on the cost, because there's a lot of factors that go into it. Our program is priced on a county level, but we realize there are several counties that may be small and they've grouped together to form a region, and they're sharing their abatement funds to maximize the amount of programs and impact that they can have in their area. So our platform does come standard with 10 users. You automatically get access to the customer success teams. You get access to our opioid abatement specialists and experts. You get initial onboard training. We have on-demand training. You have full support within the system. So I would look, if you're interested in connecting with me, I'd be more than happy to send you the cost for CARES. My email address and my phone number are displayed on the page. Okay, looks like we've got one here for Caleb here. Let's go ahead and look at this one. It says, hello, can you talk a little bit more about the data collection process for the analytics? Have you already pulled data for every county, or is it pulled after a contract is established? Thank you.
Yeah, it's a great question. And, we take an all of the above approach. So we have many data sets. You heard from Leanne early in the presentation, over 1 billion records and so on. And I think there was a slide that included examples of the types of data sets: epidemiologic indicators, economic indicators, sociodemographic characteristics, vital statistics, and so on. Those are all pulled and ready to go. I mean, we could tell you in half an hour some of the key parameters for your city or county or collection of counties, if we wanted to. But CARES is also built so as to allow for cities and counties to input additional data beyond the data that the platform already includes. So we have taken many, many different data sets that are publicly available and use them to derive and build these models, epidemiologic and economic and resource models, for your particular jurisdiction. But again, CARES also allows for us to input additional data that may be that may sit within the county but not be in the public domain. And CARES provides a platform for those data also to be incorporated into the solution suite.
Awesome. Thank you so much, Caleb. Another question that I have is, how is CARES different from other tools out there that are somewhat free? Some of them are free to offer cities and counties to tackle the opioid epidemic.
Yeah, it's a great question, and I did mention, that there are organizations and groups that are also trying to support cities and counties by developing abatement resources. I think some of the examples that I provided, for example, are like a measurement library that's just a library of particular indicators that might be used to assess program impact, or another group has developed treatment guidelines for best practices for treating individuals with opioid addiction. CARES is not just a tool. It's not even just a toolbox. It's a platform that allows for all of the different functionalities that you've seen, starting with needs assessment and prioritization and strategy, all the way down to reporting and accountability and compliance and everything in between. So CARES is really pretty different and unique in its ability to serve as this platform. And this is as I said, it's valuable for many different reasons. But one of the other ones I don't know that's been mentioned is that we recognize that there will be turnover and changes in leadership and in administrations and in governance over the course of the next 2 decades or more in every jurisdiction. But 2 decades or more is what it's going to take to fully abate the opioid epidemic. And so CARES provides for a central platform that provides that legacy, that provides that continuity, so as to ensure that cities and counties aren't just spinning their wheels or reinventing the wheel every few years with changes in administration or governance or leadership.
Thank you. That looks like we're wrapping up our questions for today. I would like to thank NACO again for the opportunity to partner on today's presentation, and thank everyone that has attended. I would also like to thank Dr. Padula, Dr. Alexander, and Rick Rose for joining us today and sharing your insights. Thank you, everyone. Melissa, I'll turn it back over to you.
Yeah, thank you again to all of you for your presentation today. Just to let everybody know, we will be sending out the webinar along with any resources very shortly. And then feel free to reach out to their team directly with any additional questions. But that's it for today. So thanks for joining us.
Thank you.